I've been the director of the Health Science Libraries here at the University of Minnesota for a little over 3 years. And in that time, I have been contacted quite a few times by people outside the university for access to our online resources. They can, of course, come to the library to use them, but they want to be able to use them remotely, from their home, from their clinical setting, from out state. Unfortunately, we cannot provide that kind of access because of agreements with the publishers. We're limited to only providing it to current student, staff, and faculty, and not to those outside of the university. So the Minnesota Electronic Health Library will benefit many people across our state, from the healthcare providers who need to have access to the best evidence on which to base diagnoses and treatments, particularly in rural settings where they cannot afford these costly resources, to our students who are training at over 35 institutions and need to learn how to search for the best evidence and critically appraise it and apply it in a clinical setting, to our caregivers. There's 600,000 caregivers in our state, and they too would have access to these types of resources. They're easily searchable and understandable. And then, of course, it would apply to everyone in our state, all 5 million citizens. I started the Minnesota Electronic Health Library proposal as a professional project 2 years ago. We have a land grant mission here, an outreach mission in the biomedical library, and it was important to us as librarians. But 1 year ago, it also became a personal project. This is an image of a CT angiogram of a heart, and the arrows are pointing toward a blockage. That artery is 95% blocked. This is an image of my heart. 1 year ago, at the age of 48, I was diagnosed as having had a mild heart attack. The doctors did not know why this had happened to me. I was fortunate it was caught. They put in a stent, and a few days later I was out of the hospital and I went home immediately and started looking up information on why this could have possibly happened to me. What I realized when I was home looking up this information was that I had access to resources that most people do not. And that really hit home. We're seeking funding from the legislature because we think that the Minnesota Electronic Health Library would be a great benefit to the entire state. We believe in equal access to high-quality, reliable health information for everyone.